Human body consists of more than 60,000 billion cells, which make up the human body. And together they form the tissues, which makes of our different organs, like the lungs, or liver. When our body needs it, our cells replace those cells that are defective, and split into two different cells. This helps our tissues to preserve their shape, and their respective functions. This process is controlled by nucleus of the cell. Any mutation, damage, or change in genetic material of cell, by environmental or internal factors, sometimes results in cells that do not die, and keep on multiplying, until the massive tumor cells develop. If these tumor are restricted to one place, that is called benign tumor. This tumor, however, only becomes really dangerous when these cancerous cells begin to invade into the adjacent areas through the circulatory system and lymphatic system, thereby establishing colonies in different parts of the body, which leads to death. This process is called metastasis. Breast cancer. It is a group of cancer cells that starts in the cells of the breast. Human breast consists of skin, duct, lymph node, lobule, fat, and blood vessels. Breast cancer can be of 5 different types. Ductal carcinoma in situ is a non-invasive breast cancer and is considered the earliest form of breast cancer. It grows slowly inside the milk duct walls, without any halt, in the form of cluster of cells. It does not move outside the duct. Invasive ductal carcinoma. It begins in the milk ducts of the breast, and it is not restricted. Instead, it grows through the duct walls, and into the surrounding breast tissue. And it can metastasize. Women's breasts contain glands, called lobule. These are the glands that produce milk, which then moves through the ducts towards the nipple. There are 2 conditions that can affect the lobules: lobular carcinoma in situ and invasive lobular carcinoma. Lobular carcinoma in situ results in the presence of abnormal growth of the cells inside the milk-producing glands of the breasts. However, if the tumor continues to grow, it moves outside through the wall of the lobule, and begins to invade the surrounding tissues of the breast. This is called invasive lobular carcinoma. It is sometimes called infiltrating lobular carcinoma, and it is the second most common type of breast cancer after invasive ductal carcinoma. Mixed tumor. It is a form of breast cancer that spreads over both ducts and lobules. It also contains a variety of cell types, such as invasive lobular breast cancer, combined with invasive ductal cancer. Inflammatory breast cancer. It is uncommon but aggressive form of breast cancer, in which lymph vessels of the breast becomes blocked by cancer cells. Breast becomes large in size and looks swollen, red, and warmed. Causes of breast cancer. Family history. Early menstruation. Late menopause. Hormone replacement therapy. Late childbearing. Exposure to harmful chemicals. Or exposure to radioactive rays.